We're going to talk a little bit about why shortly. My new friend Nick is going to help put up some slides so we can have some visuals for you to follow along with. But yes, my name is Tori Anderson. I'm a certified dementia practitioner and the dementia care specialist for the South Carolina Department on Aging. Our motto is aging so cool, everyone's doing it. Right? Okay. I'm here all week. Okay, so we can go ahead and move to the next one. So we're going to have about 45 minutes today where I'm going to speak to you about just a general overview of Alzheimer's disease, other forms of dementia, and some information that can empower you in your communities to know what questions to ask and to advocate for yourself and your families, because that's really important. So here's my first question, and this is the common question that I get from a lot of people. What is the difference between Alzheimer's and dementia? Right? So guess what? Dementia is actually not a disease. Dementia itself is just a general term used to describe a loss of memory, reasoning, judgment, or other thinking abilities that are severe enough to impact a person's day-to-day life. Alzheimer's disease is one of many brain diseases that cause those symptoms of dementia. So Nick, if we can fast forward one more, there we go. The way that made sense for me to understand it is to remember that Alzheimer's disease is always a type of dementia, but not all dementia is Alzheimer's disease. So we can kind of think of dementia as an umbrella, right? Those umbrella of symptoms, and under that umbrella are the different diseases that cause those symptoms. Do you know what? Globally, they've identified more than 100 different types of dementia. Most commonly here, in addition to Alzheimer's disease, are vascular dementia, Lewy body dementia, and frontotemporal disorders. And we're going to talk a little bit about some of those because the journey with each of those types of dementia can be very different. So we're going to talk about the 6 areas of cognition that can be impacted by dementia. And typically at least 2 of these domains are impacted. First is complex attention. That's our ability to control and divide our attention and focus. Executive function. That happens in the front of the brain. It's our ability to plan, problem solve, critically think, use good judgment, and regulate our emotions. We've got learning and memory, that ability to take in information and be able to retrieve it later. The formation and comprehension of both verbal and written language. These last 2 are a little bit lesser known. Perceptual motor, that's our ability to understand and make sense of our environment around us by the use of our senses and our motor skills. And then social cognition, which is our ability to understand how to behave appropriately in a social setting. The most important thing, if you learn nothing else today, is I want you to walk out of here understanding that no form of dementia is at all a normal part of aging. Our risk increases as we age, yes, but it is not a normal part of aging. All right. Mild cognitive impairment, or MCI, this is a common question I get too. What on earth is that, right? It's not actually dementia. It's what I would kind of call a pre-dementia. It's on that continuum of aging between what we would call typical aging and the first stage of an actual dementia. With MCI, you notice some differences in your cognition, but they're not really severe enough to impact your day-to-day life. But they're probably pretty annoying, right? We've all had those. With MCI, about 10 to 20% of people who are diagnosed with it will go on to be diagnosed with dementia within a year's period of time. But that's a pretty low percentage, right? If diagnosed with MCI, guess what? there are things you can do to prevent and delay the progression of that into a dementia. We're going to talk about those shortly too. Who knew that you'd have me up here talking about dementia and there's some good news, right? So causes of dementia. The number one cause is Alzheimer's disease, encompassing about 60 to 80% of dementia diagnoses, but it is not the only type of dementia. The second most common is vascular dementia, which is caused by conditions like strokes that limit the flow of blood to the brain. Now, this is one of the more challenging ones because it depends on where that flow is blocked, how that's going to actually affect that person, right? But typically you see confusion, trouble concentrating, issues with focus, planning, and organizing. What's really important to understand with vascular dementia is although you cannot reverse the damage caused by it, you can do things to limit the effects of it. Things like managing hypertension, high cholesterol. All right. So the next is Lewy body dementia. And this is very connected to Parkinson's disease. So there are two general diagnoses under Lewy body dementia. Dementia with Lewy bodies is the first. And with that, cognition is affected first. And down the line, you start seeing some of those motor concerns, similar to those with Parkinson's disease. Here's what's different about dementia with Lewy bodies. In the early stage, memory is not super impacted typically, especially compared to something like Alzheimer's disease. In the first stages of Lewy body dementia, you often see things like hallucinations, sleep disturbances, sometimes acting out dreams in the middle of the night. Really significant fluctuations in cognition from day to day or even hour to hour. The second is Parkinson's disease dementia. And that is when the cognitive impairment arises a year or more after those motor concerns that are so Parkinsonian begin. Now, not everybody with Parkinson's disease will go on to develop dementia, but about 70 to 80% will. Frontotemporal disorders. Who's heard of this, FTD? Anybody who's, yep, okay, good, we got a few people. Do you remember when Bruce Willis was diagnosed? Yep, that's what he was diagnosed with. And there are three different types generally. The first is behavioral variant, and that affects that frontal area that allows us to understand and behave appropriately in a social setting, right? So things like a lack of impulse control, a lack of empathy, not understanding social cues for somebody who typically always did, right? The second is primary progressive aphasia, and that affects a person's language. That's actually what Bruce Willis was diagnosed with. And the third is progressive motor decline, and that's a little bit more rare, but there are some subtopics within that. Here are some really important things to understand about frontotemporal dementia. Number one, memory is very intact, typically, in the first stage. Secondly, it tends to strike people at a much younger age. The majority of people diagnosed are diagnosed between the ages of 45 and 64. Because of those two things, FTD is often misdiagnosed. In fact, it takes about an average of 3.5 years to get an accurate diagnosis. So that's why it's really important that we have this information so that we can advocate for ourselves and our family members, even with the medical community, right? We need to advocate for ourselves. We need to know what questions to ask. We need to know what to look for. Be informed, knowledge is power. All right. It's also possible to be diagnosed with more than one type of dementia. The most common is Alzheimer's disease and vascular dementia. There are actually, like I said, over 100 different types of dementia. that have been identified globally. If you go to the Alzheimer's Association website, they have a great interactive tool where you can learn about the different types of dementia. And I would definitely recommend that you go there to learn those things, because a lot of people think, oh, memory loss. And yes, that is a very common first sign in some forms of dementia, but not always. All right. Ooh, I hate this term, but it's used all the time, so I'm going to talk about it. Reversible dementia. So just to be clear, no actual brain disease causing dementia is reversible. I cannot wait for the day where I don't have to stand up here and say that. But present day, that is the case. Reversible dementia basically is symptoms that mimic dementia, but are actually caused by medical conditions that can be treatable. So things like depression, infections, medication interactions, thyroid issues, hearing loss, all sorts of things, nutritional deficiencies, dehydration, malnutrition, trauma, all of these things. So this is one of the #1 reasons I tell people, go see your doctor, right? I'm going to be very honest. I hear a lot of people say, well, had some hard times remembering stuff, but nothing I can do about it. Well, that's not true. Please go see your doctor, because there might be something, in fact, that you can do about it. All right. So normal aging versus dementia. I'm not a big fan of the term normal. My husband says normal is a cycle on a washing machine. But sort of typical aging versus, what is something where we might have kind of a flag that there might be something not right. So, all of us can be forgetful at times, right? And yeah, I mean, nobody in this room, I'm sure, but other people can be forgetful at times. It's never happened to me. But it typically, although it's annoying, it's irritating, right? It doesn't typically affect our day-to-day lives and our ability to care for ourselves. With typical aging, things like memory loss, we're like, it might be situational and temporary, but you can resolve that quickly yourself. Somebody with dementia is going to have more of a global issue and not able to follow the steps to resolve that issue. So, who here has lost their keys before? Or their glasses? Or their cell phone? Right. If you're not raising your hand, I no longer trust you. This happens to all of us, right? But let's say, if you lose your keys, what do? Right, you retrace your steps. You try to figure out what you did with them. Okay, I want to take the minivan today. Can't find the keys to the minivan. Well, when was the last time I took the minivan? Oh, it was yesterday. I went grocery shopping. It was raining. I go check the pocket of my raincoat, and guess what? There are my keys. Right, but somebody with dementia is going to have less of an ability to be able to problem solve to find those keys. Or they may run across their keys and not know what they do for them. The next one, sometimes we miss a payment. That's going to happen sometimes, right? You go back, you figure out what happened, you try to prevent that from happening again. Somebody with dementia is going to have more challenges with this becoming a trend. Or they generally have a hard time managing their checkbook. People still use checkbooks? I do. Am I the only one in here? Okay, my kids are like, what's that? Or generally managing a budget, right? This was actually the first sign that my dad had an issue, because he was writing the same check 3 times for the same bill. And so we were getting phone calls that they were getting overpaid. So, occasionally making a decision without thinking things through. Again, I know nobody in here has done that, but sometimes people do. Like, the donut I had for breakfast this morning. Probably should have thought that through better. But this is going to be something where it's a risky decision for this person that they would not have typically made, right? So my mom had some frontal lobe issues, and she was always very secure with her information, like hyper secure. In the last couple of years of her life, she was just giving out her credit card number to anybody who would listen. And I knew, I'm like, that's not her, right? Forgetting what day it is and remembering it later. Who thinks today is Sunday? But eventually, we will remember, okay, today actually is Saturday. And you'll be prompted to kind of realize, okay, this is what I'm doing with the rest of my day. Somebody with dementia is going to be maybe unable to remember what day it is, not able to recall that later, and not even be on the track to know that they were trying to realize what day it is. Or they may have a global issue, more with like what season it is or what year it is. Getting lost in unfamiliar places and then finding your way. I'm notorious for this, ask my husband. So when I do get lost, I'll pull up Google Maps, or I'll stop and ask directions, and I can follow those directions and get back on track. Somebody living with dementia is going to have more of a challenge doing that. They're going to have issues getting lost coming home from places that they've gone to many times, or they may not recognize that they're lost. Sometimes having trouble finding the right word. I think that's already happened to me 3 times since I've been up here. But, you know, and isn't that annoying? It's so annoying, and if you're like me, you think of it later, when you're no longer in that conversation. But you will think of it later. And there's also a difference between if you're trying to think of the word ubiquitous versus if you're trying to think of the word phone, right? Sometimes you'll see somebody describing rather than using the word for something. So, you know, that thing that you put up to your ear to talk to people with, because not being able to retrieve that word phone, right? And phone is a very common word. That's going to be a flag. So these are some of the top 10 warning signs of dementia, and some of these are things that I think we probably, before we walked in this room today, all sort of maybe associated with dementia. So like memory loss that disrupts daily life, new problems with words and speaking or writing, having a hard time with language. But there are other things on here, things like changes in mood and personality, issues with visual perception. Also, people can be diagnosed with a form of dementia as young as their 40s, right? So if you see these signs in somebody, don't discount them because that person seems too young. An unfortunate but a very good example is my brother Craig, who came to visit me about a dozen years ago from Colorado. And we were walking outside to go to dinner, and he was having to feel for each of the steps to go down the front steps of my house with his feet. And then he was taking big steps over the cracks in the driveway to get to the car. I was like, that is really strange. Playing a board game that night, he couldn't find where to put his piece on the game board. He said, we need to go get your eyes checked. And we did. And guess what? His eyes were fine. Fast forward 3 years and 2 misdiagnoses later, he was diagnosed with a rare form of Alzheimer's disease called posterior cortical atrophy that is just like Alzheimer's disease, but it starts in that part of the brain that handles your perceptual motor skills. His memory was really pretty good, but his ability to comprehend his surroundings was significantly impaired. He was diagnosed at 56 after having had symptoms for several years at that point that were misdiagnosed. If I had known what we're talking about today back then, I would have been a much better advocate for him. But I didn't know that. And that's why I'm here today. All right. Dementia facts and figures. So we're really lucky in the state of South Carolina. We have an Alzheimer's disease registry that's managed out of USC. And this is diagnostic, comprehensive information about dementia diagnoses around the state. And this is really, really important information for us to have so that we can make sure that we are identifying hotspots and areas. The Alzheimer's Association released a report last year that ranked counties throughout the entire country by Alzheimer's disease prevalence. Orangeburg was number 8. So I'm really happy to be here with you today. I know not everybody here is from Orangeburg, but this is really, really important. We need to target this. And so this registry, it has shared the most recent numbers are that we have about 123,000 people in the state of South Carolina who have been diagnosed with a form of dementia, 73% of those with Alzheimer's disease. That does not include the people who are living with dementia that is not diagnosed. So 65 and over, 11% of that age range has been diagnosed with a form of dementia. That jumps to 55% for those 85 and over. 61% are women. Everybody reading this next stat? African Americans aged 65 and over are 34% more likely to have dementia than our non-Hispanic whites. Who thinks that is acceptable? Yeah, I don't either. So we have an Alzheimer's and Dementia State Plan, and that's one of the target goals that we have. I have a subcommittee meeting on Tuesday. We're going to be talking about what we can do to make that a much different statistic. According to the Alzheimer's Association, we have 219,000 people living in our state who are caring for a loved one with dementia. Who thinks these numbers are going to go down? No. This is a crisis, y'all. All right. So we're going to talk just for a couple of minutes about Alzheimer's disease specifically because it is the most common form of dementia. So if we were to jump into a healthy brain and look close up, it would look something like this picture on the left. And this is neurons in the brain that are communicating with each other through electrical and chemical messaging. With Alzheimer's disease, proteins in the brain form into what we call plaques between those neurons and disrupt the communication between them. Another protein within the neurons breaks down and disrupts the ability for the neuron to transport nutrients that are necessary to keep them alive. With time, those plaques and tangles travel through the brain and it turns into this picture on your right. And what happens is those brain cells eventually can't survive. The brain cells die, the brain shrinks. You can see a comparison of a healthy brain versus a brain with advanced Alzheimer's on both sides here. And I really want you to keep this picture in your head. If there's anybody in here who is caring for or supporting somebody with Alzheimer's disease or another form of dementia, I want you to understand that this is what their brain looks like. So if it's challenging, just understand it's not that person's fault. This is their brain. Okay. We basically have 3 major stages that we walk through with Alzheimer's disease. It starts in that temporal lobe where language and memory are formed, among many other things. But that's why with Alzheimer's disease, memory loss and language issues do tend to be an early sign, right? So forgetfulness, repeating yourself, getting lost on the way home from the grocery store, the bills issue that I was telling you about with my dad. Things like that are going to be kind of a first sign and early symptoms. That person's going to have some confusion in conversation, probably. They're going to become easily overwhelmed, especially in social or chaotic situations, losing and misplacing valuable objects, and then difficulty performing daily tasks. But guess what? The list of the things that this person can do is way longer than the list of things that they have trouble doing. So the important thing at this stage is to find out what they can do and help support them to do it, right? Keep that person engaged, empowered, and involved in activities that are meaningful to them. We then move into the moderate stage. And so we see increasingly, we see the increasing in blue here, right, where it's just starting to continue through the brain and that cell death is continuing to happen. You do see typically an increase in poor judgment, confusion with time and place, and that's what leads to that wandering in some people. Unable to recall personal information, like important information, like your phone number or your home address. Jumbling words. Changes in sleep patterns may have that person up a lot more at night and sleeping during the day. This can be particularly challenging for caregivers, especially living in the home. Some personality and behavioral changes. Things like repetition, agitation, suspicion, right? I teach a class called Dementia 201. It's totally free. I have flyers. I'll tell you about that at the end. But it talks about some ways that caregivers and people supporting people living with dementia can help to either prevent or respond to some of those challenges, which makes it easier on the person living with dementia and their caregiver. And then we move into the severe stage where there is significant damage to the brain, substantial changes in that person's physical abilities. They probably will lose their ability to walk, eventually lose their ability to swallow, lose their ability to verbally communicate. And so they have to communicate in other ways, which of course then also makes it challenging on caregivers. They're going to probably sleep a lot more often. They're going to have difficulty eating. Weight loss is a very common result of that. And this person is going to be vulnerable to infections, things like pneumonia, and that has a lot to do with the swallowing, right? And around-the-clock assistance with daily personal care is going to be needed at this point. Does that seem like normal aging to anybody? No, it's not normal aging. All right. So what increases our risk for dementia? This may be my favorite part of the presentation because there's some positiveness in this, right? So it turns out that advancing age is the greatest risk factor. Womp womp. I haven't figured out how to not age, so that's probably not going to be something I have a lot of control over, right? If you don't have to have a family history to get something like Alzheimer's disease or another form of dementia, but it does increase your risk if you have an immediate family member, that's a parent and or a sibling. If you have more than one, then that doubles your risk. So I really won the jackpot with that one. Right, genetics, so there are basically two types of genes that will determine if we end up with a disease. Risk genes, which is exactly what it sounds like, it increases our risk, but doesn't necessarily mean we're going to get it. And the deterministic genes, which means you're absolutely going to get that disease. Although both have been found in Alzheimer's disease specifically, only 1% of Alzheimer's cases were caused by deterministic genes. So a common question that I get from people is, should I get tested? First of all, I'm not qualified to answer that, but I can tell you that the medical community in my research doesn't typically recommend it because it really is only going to tell you what your risk is, right? It doesn't mean you are or are not going to get it. We talked a little bit about gender, race, and ethnicity. People with Down syndrome have a much higher risk for Alzheimer's disease because there's an overabundance of what is called APP protein on that chromosome 21. The good news is the average lifespan of people with Down syndrome has significantly increased. In 1985, it was 25 years old, and today it's 60. That's awesome, but it also has now created this new challenge medically to support people with Down syndrome. So Not a whole lot we can do about this stuff on the left, but the good news is there are some things that we can do to manage our risk. The Lancet Commission has come out with studies over the last 10 years, and their study released this year said that there are 14 risk factors that, when managed appropriately, can delay or prevent Alzheimer's disease and other forms of dementia by 45%. Y'all, that's huge. I wish I could say I brought magic pills for everybody today, and that's what it is, but unfortunately it's all the stuff that we know we're supposed to be doing, right? So things like traumatic brain injury, right? Wear your helmet, wear your seatbelt. There's a huge connection between heart health and brain health. So when you get up in the morning and you take that walk, or you decide to have a salad for lunch, not only are you helping your heart, you're also helping your brain, right? So regular movement. This doesn't have to be going to a gym and running on a treadmill 4 days a week. Go for a walk outside. It's beautiful today, right? Go for a swim. I take a dance class on Wednesday nights. Am I any good? No, not really, but it's a lot of fun. And you get a good workout and it makes your brain work because you got to think about what they're doing with the movements, right? Just find something that you enjoy that happens to get you moving. Quit smoking. And if you smoked for 50 years and you quit today, that will benefit you. Limiting alcohol, minimizing other health issues. Obesity, diabetes, hypertension, high cholesterol, and depression are the big 5 that are very directly related to dementia. If you have any of those 5 things, your risk is increased. If you have all 5 of those things, your risk is really increased. So the better we can manage those, the better off we are. Socially engaging. You guys are doing a great job at that today. Keep it up. Minimizing hearing and vision loss. Did you know that hearing loss can actually cause dementia? I didn't know that until I started in this job. Yep. And as soon as you put an intervention in place, just like if you quit smoking, immediate benefits. So if you have an issue with your hearing, get it checked out. Get some help with that. And then learning new things, right? A new hobby, a new language. I would love to learn how to garden. I would love to learn how to sing. Be so happy I'm not up there with you right now. Unless you're ready to clear the room. Beautiful voices, not here. But maybe I might want to learn how to do that, right? It engages your brain. The more of these things we do, the more we minimize our risk for dementia, and the more that can combat some of those things in the list on the left. All right. So, diagnosis. This is a soapbox I get on quite a bit. A lot of people, I hear this and it just hurts my heart when they say, well, there's no point in getting a diagnosis because there's not a cure anyway. That is absolutely not true. It is true that there's not currently a cure. Unfortunately, that is true. But there are a lot of things. So if you're diagnosed with MCI, or you have one of those reversible dementia symptoms, that's something you have some control over. But if you wait too long, that ship has sailed. Many treatments are approved only for the early stage of certain types of dementia. So knowing what type of dementia. So remember we talked at the very beginning, dementia is not a disease. Dementia is symptoms. So if you go to your doctor and they say, I'm going to diagnose you with a fever, you're like, that's nonsense. What's causing the fever, right? You push and you get an accurate diagnosis. Now, the medical community is certainly not perfect, and there's a lot that they still don't know. But a diagnosis of dementia should never be a final diagnosis. being involved in clinical trials. If you don't know how to get connected to one, because nobody really does, reach out to me. Go to the Alzheimer's Association's trial match, and they can help connect you with a clinical trial that makes sense for you and your family. You have more time to take advantage of resources. There are a lot of resources out there, but they're not going to be instant, right? Stay ahead of that. You would not believe the number of people who call me with their hair on fire in a crisis. And if they had just done some things in advance, it would have been a lot easier for them. And then guess what? Your medical record is your family's medical record. Do it for your family. Your kids' kids, your siblings. It's really important for them to know what is running in the family. So how does somebody get a diagnosis? Usually that starts with a primary care provider. Please understand, there's no one test that can diagnose dementia. It's a holistic process. So usually your primary care doc, they're going to know you best, right? They're going to know your history, your family history. They're going to run some blood work, urine sample, all of those things to try to rule out any of those reversible dementia symptoms. They may do a cognitive assessment, and then if they have any concerns, they'll probably recommend a specialist. At that point, maybe a neurocognitive test is done, brain scans are done, and then a diagnosis is made. Keep in mind, we do not have enough specialists in South Carolina. I don't think any state has enough of them. But you could see a geriatrician. That's somebody who specializes in older adults and tend to be very well versed in topics of dementia. Neurologists who specialize in the brain and nervous system, not all of whom specialize in dementia. The brain is a very complex organ. Geriatric psychiatrists or psychologists, and neuropsychologists. That's actually how my brother was finally diagnosed. They are trained to deliver testing to be able to diagnose. Because it is hard to get appointments with some of these folks, come prepared with questions. I'll have my contact information up at the end. I can help connect you with some resources on questions to ask. The most important thing is, dementia is never a final diagnosis. So you ask questions, what's causing dementia? Okay. So the FDA the Federal Drug Administration has 2 general classes of drugs that are approved for people living with Alzheimer's disease or other forms of dementia. The first treat cognitive symptoms. So that's things like Aricept, Exelon, Razidine, Namenda. These do not reverse or slow the progression of the disease. That is a common misconception. They do help manage the symptoms for a limited time. But here's the good news. In the last 2 years, there have been 2 new drugs, really 3, but they've focused now on 2, that actually help slow the progression of Alzheimer's disease. They use a monoclonal antibody that basically, think of a magnet, connects to plaques in the brain and removes them. Right? We've learned that that's a hallmark of Alzheimer's disease. And they are really starting to see some great benefits from this. Now, it's administered via IV. Thankfully, the Centers for Medicare and Medicaid have agreed to cover the 80%, because guess what? It's $30,000 a year. I have a lot to say about that, but I work for the state government, so I have to keep my opinions to myself. But the good news with that is that this is very hopeful, right? We have a lot of hope, and there's a lot that's happening in research that is going to make this better. Next steps after diagnosis. All of the things that we talked about that help reduce your risk also help limit the effects in those early stages. Keep living your life. Do things that are meaningful for you. Don't sit at home. Care planning, it's really important to make sure you get an accurate diagnosis. You learn everything you need to know about that diagnosis, and you help put together a care plan for your loved one and for yourself. There needs to be a care plan for the caregiver. We do not want you caring for your loved one at the expense of caring for yourself. That doesn't do either of you any good. I feel like a little bit of a hypocrite up here saying that because I wasn't super good at that. I didn't know then what I know now. And then knowing what support resources are out there. Oh look, everybody's favorite topic, legal and financial. Really important to understand. People are like, oh, I don't want to talk about that, right? Getting your legal and financial affairs in order is as much, if not more, about having a great quality of life than it is about what happens after, right? Get a power of attorney in place for your legal and financial affairs. Get a healthcare power of attorney in place. Find a trusted agent. The healthcare power of attorney, you don't need an attorney, nor do you need a notary. You can get it off our website. Print it off and you can have multiple people if you need them. Same thing with the durable power of attorney, but I would seek legal counsel on that because there's very broad or very narrow language and everybody's a little bit different with what they're comfortable with. The most important thing that you need to understand is that the only person who can set up a power of attorney and designate an agent for you is you. And you have to be deemed competent to do that. So if you're in the mid stages of dementia, you get that diagnosis and you don't have those set up, that ship has sailed and it's going to be in the courts. Every single person in here should have a durable and a healthcare power of attorney and a will. If you don't, get it done. Make it a priority, not just for you, but for your family. Other things like making sure you have proper names on bank accounts and investments, making sure you have beneficiaries set up that make sense. All right, so some resources in South Carolina. Again, I'm a dementia care specialist with the South Carolina Department on Aging. I'm super excited that our state has agreed to allocate $1.1 million in the state budget to add 9 more of me throughout the state. Because one person for $123,000 is not good. So we are starting our first one in Hartsville in January. So our primary responsibility is to get out and educate people like I'm doing today, and then to consult with people to help them through situations and get them connected with support services that can help. And then to help create and support programs that support families living with dementia. We serve all 46 counties through 10 regional offices. The office that serves Lower Savannah here in Orangeburg is our Lower Savannah office, but there's an office for every county around the state. So if you go to getcaresc.com, it will tell you what office serves your county or your family member's county, and they can help get you set up with things like in-home care, respite care, Medicare counseling, legal services, transportation. I always call it the best kept secret that we're trying not to keep. Also, the Alzheimer's Association, they have a 24/7 helpline where you can call and talk to a trained professional. Now, if it's an urgent emergency situation, don't call them, call 911. But they can help you. If it's 3 o'clock in the morning and your mom is roaming around your house and she's agitated and you don't know what to do, call them. They can be helpful. You can call me too, but probably not at 3 a.m. They have a great round the clock. If your loved one is a veteran, there are all sorts of services through the VA, including a family caregiver service. USC's Office for the Study of Aging also has a caregiver training called Dementia Dialogues. It is 6 hours and totally free and gives you good practical tools on how to approach care and support for a loved one living with dementia. I do like to make a quick shout out for support groups. I feel like these are undervalued resources. When my dad was diagnosed, I had an infant and a 6-year-old and a 14-year-old and a full-time job and a husband who was traveling. And someone said, you should go to a support group. And I was like, I don't have time for that. But you know what? I ended up going. I really regretted waiting. I thought, I was like, I'm going to go to this and it's just going to be people complaining and then I'm going to be more depressed when I leave. And it was anything but that. It was so affirming and validating to talk to other people who were walking a similar path. They also can tell you about resources that they've used that have worked, that can help with coping skills, and they oftentimes bring speakers in on different topics. So if you need help getting connected to one, please let me know and I'm happy to make that happen. We do have some upcoming dementia education programs. You can scan the QR code. Ms. Clark has some handouts that she's going to bring out front with flyers. So if you're interested, these are both virtual options, totally free and open to absolutely anybody. I had somebody from California and Canada on my one last week. So the information is helpful for anybody, regardless of whether they live in the state of South Carolina or not. So please feel free to register for those. And Dementia 201 is the one that I was talking about that talks about some practical tools to, strategies for communication and problem solving and balancing safety and independence. Keep going, we're not going to worry about that. There is my contact information. If you or somebody you know is dealing with a suspicion or a diagnosis of dementia and you need help navigating that, I'm your girl. You call me, you email me, whatever's comfortable for you, totally confidential, and I can help connect you with the resources that we have available. I would like to thank Reverend Priester and Reverend Priester, Ms. Clark, who, I'll tell you what, how long have we been trying to do this? Like several months, trying to get this on the books. And I'm so excited that I could be here today. My daughter is in a show in Columbia at 2, so I do unfortunately have to leave after I'm done to head back and make sure I catch her performance. But I was really, really proud and honored to be asked to be here today. And I want to make sure that you all know that I'm a resource for you. And I'm not sure how much time I have left. Are there any questions that I can answer? Yes, ma'am. They don't want to be in water. That's kind of depend on the person probably. But part of it is, like, when you're approaching somebody who's living with dementia, it's important to keep in mind that they are struggling to process their environment and they may not understand their environment. So water might be something that can scare them. It might be the temperature of the water. Like, one of the things that can be really challenging when caring for somebody who's living with dementia is bathing, right? So my number one piece of advice with that is engage that person, right? I'm gonna kind of stick my neck out here a little bit, but like, close your eyes for a second and picture somebody taking all your clothes off, sitting you in a cold shower chair, turning water on without any notice. The water's too cold, right? How do you feel? You feel exposed, embarrassed, confused, afraid, right? So oftentimes the situation with water can really have little to do with water and more to do with how we are approaching the situation that has the water. Now, it's very possible that a person has a history and doesn't like water, and that's a separate issue. And understanding that person's past traumas is really important when trying to care for somebody who's living with dementia. That's an interesting question. No one's ever asked me that. Anything else I can answer for the good of the group? Yes? So the question is, what is the life expectancy of somebody who has been diagnosed with a form of dementia? And of course, that can really vary a lot by person. The average from time of diagnosis of Alzheimer's disease to death is an average of 8 to 10 years. Other forms of dementia can be very different. And even within a type of dementia, the length of time and the exact journey can really vary between people. We have a phrase, if you've met somebody with dementia, you've met one person with dementia. But about 8 to 10 years is the average. You may. He was not able to drive. Now, he did drive longer than he should have because he was diagnosed with adult ADD. Posterior cortical atrophy, yeah, that's typically something that if that person is having, just like we have to get our eyes tested, in this case it wasn't his eyes, but it was his ability for his brain to process what his eyes were seeing, that's going to be kind of the same thing. There's a great driver rehabilitation program through Prisma Health where they can actually take your loved one and say, okay, let's do a quick written test, let's do a quick interview, and then maybe a practical test, and they can say yay or nay to whether or not they're capable to drive safely. But sometimes they'll say, hey, you know what, you can drive to the grocery store. Treatable. The posterior cortical atrophy? No. No, that's a progressive disease. Yeah, and he's now in a memory care community. He basically can see very general shadows at this point. And now it's progressed to memory issues and pretty significant language impairment. Yes? Thank you, Brenda's keeping me on track. So we have a bunch of flyers that we're going to leave out front that talk about some of the upcoming education and things like how to support somebody with dementia during the holidays. In crisis situations, certainly our state has had a few of those in the last couple of months. But there's also an awesome program. Dr. Fayron Epps is conducting and leading a study called Caregiving While Black. And they are looking for people, this is totally free for you to participate in, and they're trying out a caregiver support program, and they're looking for people to participate and give feedback. So if you know of anybody who fits that bill, please take one of these flyers and get signed up for that. Thank you, Ms. Brenda, for reminding me. Appreciate it. Well, listen, y'all, thank you so much for having me today. I'm really so pleased to be here. Thank you. Call me, email me if there's anything I can ever do to support you. Ms. Brenda, thank you. Reverend Priester, thank you.